Hi, I'm Katie Ullman, Senior Media Relations Specialist for Hassenfeld Children's Hospital and NYU Langone. I'm joined by Dr. Kawaljit Brar, also known as Dr. Rupam Brar, and Dr. Anna Novak, both pediatric allergists at the Pediatric Allergy Program, which is part of Hassenfeld Children's Hospital at NYU Langone.
Thank you, Katie.
Yeah.
Thank you.
Excited to be here.
So allergy season is in full swing, and today we're going to be focusing on tips to recognize and control allergy symptoms in your kids as we get through this season and difference between seasonal allergies and COVID-19. If you have any questions, feel free to leave in the comments below and we'll get to them during the live, or we'll make sure to reply afterwards. So parents have been dealing with a lot of stress related to remote learning and stay-at-home orders, but many parents are coping with another challenge: the return of seasonal allergies. So just to start, what are some common triggers for spring and summer allergies? Are there telltale symptoms associated with these seasonal allergies to look out for in kids? And do symptoms differ by age, say toddler versus teenager?
Sure. So spring and summer allergies, spring allergies, they're often triggered by tree pollens. So whatever trees are endemic to the region that you live in, those tree pollens, they move through the air, they're buoyant, which means they're bouncy. And then when we inhale them, that's what triggers symptoms of allergies. In the summer, it's typically grass pollens that, move through the air and trigger symptoms. Symptoms can be variable. So in toddlers, we can see itchy eyes, runny nose. The discharge that comes from the nose, it tends to be clear. So it's a little bit different from when they have a cold. So clear nasal secretions. You can see with toddlers that are very young, their parents will say that they rub their eyes. So those are symptoms that we can see in toddlers. You can also sometimes see flares. So eczema flares is something that I see a lot that happen seasonally depending on what someone is allergic to. And then Dr. Novak was going to talk about what teenagers present with.
Yes, so that's, some of the presentations are similar, some are a bit different, and it's usually more clear cut. Like, pollen allergies usually start a little bit later. Although I have to say, everything is changing and we see younger and younger, kids, toddlers, especially if the parents are highly pollen allergic. This, if the pollen allergy runs in the family, then we can see it really, really early. What I would add to what you said, Rupam, was also like facial grimacing. Sometimes they don't even like itch or scratch, but they make those funny faces, or they do like, they will clear their throat. In older children, they complain, right? They are itchy, they have, sneezing, runny nose, clear runny nose, itchy eyes, usually on both sides. So, this sort of distinguishes the allergic conjunctivitis from, let's say, infectious, bacterial or viral conjunctivitis that can be seen only on one side. Those usually older children, right? Like we were told that, dust mite allergy will start by the end of the first decade of life, and then pollen allergies would follow. And those kids have, pretty discrete, seasons, the times of the year where the symptoms present. And a lot of them actually complain of itchy mouth when they eat fruits and vegetables, like when they eat raw, let's say raw apples, carrots, or, celery sticks. And this can be very confusing because they used to eat those foods without any problems. And now all of a sudden they start having problems. And this can be quite alarming. But this is a very mild form of food allergy. It's called oral allergy syndrome, and it's like a separate type of allergy that does not usually produce serious allergic reactions. It's more of an inconvenience, and usually those kids can eat apple pie and apple sauce that has been cooked, because the allergens that are cross-reactive with pollen are very sensitive to heating. And the reason why those kids are having symptoms is because they have developed high pollen allergy, and there are similar ingredients in the food and in pollen. So we see it up to 40% of the patients with a pollen allergy will complain, usually when asked, because it's such a mild, condition. And it may vary, could be worse during the season or right after the season, and then sort of wanes over the fall and winter, and then comes back the next year.
Mm-hmm. Are you seeing
And
oh, sorry, go ahead, Dr. Barr.
no worries. Just wanted to add that the oral allergy syndrome, you can even see it with nuts. So even someone who previously did not identify a nut allergy thinks they may have a nut allergy. They may actually have an oral allergy syndrome related to their pollens. And actually, one more point that I wanted to mention is we talked about toddlers, but really, it's usually around 3 years that we're seeing pollen allergies. 2 years is when you might see decimate allergy. It's still very early. So babies, really young children, they really don't have pollen allergies, which people don't realize. It really takes a couple years and seasons of exposure to develop an allergy to a pollen.
But would you say that it's there's some population of patients that are more sort of at risk, right, to develop?
Oh yeah.
Right. Like, so you're a typical patient, kid with eczema. This is like a red flag. Yeah. Hey, I can become allergic, or if they have symptoms, then it's worth checking.
Yeah.
And
I see
testing.
kids that are with severe eczema that show signs as early as 8-9 months, to some, especially to some of the indoor allergens, like if they have a cat or dog at home.
Yeah.
Yeah, I start to see some
Absolutely.
allergies really early. So
are you seeing an increase in patients coming in with these seasonal allergies? And why is that? And then would you say children's risk of seasonal allergies have been increasing after a year spent mostly indoors?
So that's a great question, Katie. I have to say that we are seeing fewer patients because of the mask wearing, social distancing, staying indoors. So last year, right, during the COVID pandemic, we had absolutely no seasonal allergies. I think everybody was locked up, in the house. They wouldn't go outside. And they were not exposed, so the symptoms were minimal, and everybody got very happy about that. But this year we see more, because obviously we loosen up, and people start going out, and kids go back to school, and they play outside during recess. So definitely we're seeing more this year, and this is really focusing specifically on the seasonal outdoor allergies. I mean, there's a different sort of angle to the indoor allergies, which is quite the opposite situation. I'm not sure, it's really hard to know whether those allergies, the seasonal allergies, will get worse. I think it really ties to the exposure. If you are susceptible individual, then after that many cycles of pollen exposure, you will become allergic. I don't think that this sort of gap year is going to make a huge difference. Although, we certainly worry about little kids. Like we worry about those kids that were born or they're infants, toddlers during the COVID, because
COVID babies.
yeah, COVID babies. We call them Generation C, right? For COVID, but they, those early years of life are like a training ground for the immune system. So the immune system has to be exposed to all kinds of pathogens, bacteria, viruses to mount the immune responses. But by developing this kind of anti-infectious immunity, it also trains the immune system how to recognize what's dangerous, what's a pathogen, and what's benign, that should be ignored, like an allergen. So it's really, something very, very interesting, not only following those that were sick with COVID, but the ones sort of the bystander effect of those that were never sick, but they were, there will be consequences of the social, the isolation and the distancing and lack of exposure to infections. So yeah, it will be something that we worry about, but time will tell.
Yeah. We're also seeing with climate change that's affecting pollen patterns. So pollination seasons are lasting longer. The pollen counts are higher because temperatures are warmer. So we're seeing pollen as early as February. Seasons are also going later into the fall. So we used to say, you could stop your medicine in October. And now I just say first frost, because we know that November and December are very warm. And so that's affecting pollination. And so that also can sometimes have this long-term consequence of increasing symptoms.
But that's a great point, because it's very fluid, right? Nothing is as stable or steady as it used to be. So we're seeing changes almost like every year. And sometimes the season will start very early, but it will be quite mild. And sometimes it starts later and it just comes, in with vengeance, like, it's very high pollen count. So I do advise my patients to check online. I mean, there are many resources online where you can actually find the information about the pollen count for your zip code. And that's probably the best, if you know your child has pollen allergy, specifically for pollen allergy, they obviously don't monitor indoor allergies, but for pollen allergy, just check it and see what registers, and you can really follow it. So I was telling Katie before that today was a really high pollen count day because it was windy, it was dry, and it was sunny. So this is like a perfect storm. And then like when it's wet and when it's raining, then usually the pollen counts go down. Right. Yes, absolutely.
So what are some ways to help prevent worsening of allergy symptoms or ways to minimize the symptoms?
So it's really important that you start your medication early. And it's really important with allergies, and this could probably be translated to a lot of things, a lot of medical diseases where you want to take a preventative approach rather than a reactive approach. So waiting until symptoms happen is sort of too late. You want to have the medication on board. We generally recommend 2 weeks before the season begins. So about mid-February is when I target that my patients start their medications for their allergy prevention.
But I also want to say that in addition to what you pointed out, I recommend or advise my patients to come for a visit like towards the end of January to sort of set the stage, to talk about the medication for the season and like refresh the memories. I mean, this is what we do all the time. Parents, have other issues on their mind, and they can forget exactly what to do. I just want to point out that it's obviously there's some apprehension about visiting doctor offices, but like for instance, for us, all of the stuff has been immunized against COVID, and we're taking all precautions, so it's really very safe and comfortable, to come for the visits and for evaluation. So come before the season, come during the season, for those kids that are really suffering, because especially those with like eye symptoms can be really miserable. So we can see them and really, fine tune the management during the season.
Yeah, no reason to suffer with your allergies.
Yeah, absolutely not.
Is there anything you could do within your home to help prevent allergy symptoms, like coming in or?
Yeah, so in the home, it's important to keep windows closed. So for pollen allergy sufferers, open windows mean pollen is coming indoors. Also, sources of bringing pollen indoors is pets. So the dog and cat, they carry pollen on their fur. So that's something to be mindful of, and a reason to wash your pet frequently. There's interventions you can make if you have dust mite allergy. There's a lot of home-based stuff for dust mite allergy. A lot of pollen management is really addressed by the patient, where we recommend that they take daily baths or showers because you want to rinse the pollen off every day. I tell my patients, once you come in from the park, you shower, you change out of those clothes, and the new clothes you put in, you don't get to go back outside after that. And so that's really important because you don't want to sleep in pollen-ridden clothes. And part of that also includes like washing hair because the hair on the head, the hair on the eyebrows, they all really stick to the pollen. So it's important to rinse that off.
Perfect. Is there any like treatment options for allergies that can be considered, and do you have recommendations for over-the-counter remedies?
Yeah, there are. Yeah, go ahead.
No. Go ahead. I was just going to. Yeah.
Okay. No, a lot of times we use second generation antihistamines. Those are non-sedating. Preferred treatment for most allergists is really an intranasal steroid, which helps reduce inflammation in the nose. Saline rinses, I think those are underappreciated. Really good way to rinse out allergens, just physically remove them from the body. Even for patients with rashes, it's great because if their eczema is being triggered from the inside, removing allergens just physically by rinsing them out from the nose is also something that's important.
Yeah, I would just add that a lot of allergy medications are now over the counter. So it's just a question of getting advice which, medication is the right choice for you. And when it comes to, I totally agree with you. I love those saline nasal rinses. I like the Neti-Pot because it's just like a higher volume. I explain to the patients who suffer, usually with the seasonal allergies or chronic rhinitis, that this is like a hygiene for your sinuses. Like, you don't question brushing your teeth twice a day. You should do the same, especially in New York, right? Like, our environment is not clean. We have a lot of pollution, particle dust, diesel exhaust particles. So everything settles in. I mean, our nose serves as a filter, so it just accumulates everything. And if you're somebody who's susceptible, I mean, they will be, suffering from that. So I also, non over-the-counter approach, but it's immunotherapy. I mean, that's what we do, right? We can desensitize our patients to those allergens. If your child is miserable and suffering and cannot concentrate or cannot sleep well because of the allergies, then probably, I mean, it's the time to talk to your allergist. What are the other options? And the other options, that really the only option other than like something changing naturally in the immune system, that their allergies would go away over time, is to do immunotherapy. The medications that we're using, avoidance strategies, they don't change the course of the disease. They basically control the symptoms. Immunotherapy is the only approach that could change, could suppress, improve the symptoms, and also prevent development of additional allergies. Because those kids that they're suffering, they're sort of, a lot of them go on to acquire new allergies, new sensitivities as they get older. And, some of them even develop asthma. So there are studies that have shown that early immunotherapy might be, not only controlling the symptoms or even curing the disease, but preventing development of additional allergic problems. And we can offer allergy shots. I mean, as allergist, or there's also an option of sublingual immunotherapy, which doesn't involve shots, but it's a different philosophy and it involves daily dosing. So, those are the options that can be considered.
Yeah, my daughter did allergy shots for 3.5 years.
Yeah.
Yeah, and I was very happy with her allergies. She can play
Right. Yeah.
Yes.
And there are also biologic therapies that are in development, because really for the Northeast, the tree pollen allergy is a huge problem. Animal dander allergy is a huge problem. So there are biologic therapies, like injection therapies, but not sort of all year round, but periodically, that patients could get. But this is probably the next 5 to 10 years before it comes to the market.
That's great. Okay, so if you're just tuning in, I just want to say I'm Katie Ullman, Senior Media Specialist. I'm joined by pediatric allergists, Dr. Novak and Dr. Brar. They're just providing tips to help manage your children's seasonal allergies. So my next question is, can wearing a mask reduce allergy symptoms?
Yes, it can. Wearing a mask not only helps prevent against viral infections such as COVID, it also prevents pollens from entering into the nasal passages. Pollens are actually larger particles than viruses. Viruses are very small particles. So masks actually do a better job of blocking out pollen probably than they do blocking out viruses. But always good to select the right mask. Either what we call a surgical mask or a cloth mask, if you choose to use one, it should be multi-layer and it should be high thread count. So I've seen people with masks that resemble a thin t-shirt. Those are not ideal. Probably something that's more akin to a fabric resembling a multi-layer bandana would be better.
Should a child carry a few extra masks with them throughout the day if, say, they're, have some more severe cases and it gets wet?
If someone is sneezing a lot, they have a frequent runny nose where they need to blow, and they're not good about it, especially young kids, they're not always good about blowing their nose and it's just dripping, then I think that's a good, that they should have a replacement mask. It's a good idea for them. Yeah.
But I was amazed how good kids are about wearing those masks,
Oh,
right?
yeah.
Like when they come to the office and, when they're older than 2, they're asked to have the mask on and they're really into it. They
it
really get into it, especially if they have older siblings, they,
Yeah.
they sort of want to emulate and follow them. And they're really cute. I mean, I definitely think that wearing a mask makes a difference. We've seen this, like not only for allergies, but let's say influenza, right? Like we didn't have flu season
Oh,
last
yeah.
year. We hardly had any viral exacerbation of asthma.
Yeah.
So it just is a testimony. It does work, but it's not the most comfortable, situation. Like my glasses are always getting foggy, right? And then sometimes, like, especially if I don't know, I'm exerting myself, I feel like, it's just a little bit harder to breathe, and can be a little uncomfortable. So I think like in the future, so going forward and depending how the situation with the COVID evolves, we probably, some of us will continue to wear masks in certain situations. Like if you know that you're pollen allergic and you want to go to the park, right? You want to play on a high pollen day, then it may be wear a mask. I'm telling my patients now to wear eyeglasses, like get almost like those goggles that have like the sides, because the same thing, like eye symptoms are so difficult to control and it's so much better to prevent. I mean, when you talked about prevention, like my talks on food allergy or any aspects of treatments, like prevention is worth the an ounce of prevention is worth a pound of cure, as Benjamin Franklin said. So all of the smart people are emphasizing prevention, so it's so much easier to control the symptoms if the exposure is minimized. And that's sort of also going back to what you mentioned, that it's important to start before the season, before your symptoms really get into the full swing. It's some you'll use fewer medication and you will get better symptom control if you start ahead of time. So you have to be ahead of the game.
So just to get into just distinguishing symptoms between COVID-19 and your seasonal allergies, how just talk a little bit about that, especially if children are kind of going back to school and getting tested for COVID regularly.
So this is really a great question, and it's a bit difficult question, can be quite confusing, right? Because the symptoms are similar. Viral infections, are inducing the same kind of similar immune response, at least, in the upper airways, as are allergies. So, there's a lot of sneezing, itching, but, and I think this is particularly confusing when we don't have a diagnosis. If we don't have a diagnosis, the child hasn't been seen and evaluated, then when the confusion sort of sets in, because particularly in the beginning, right, when they start sneezing and having runny nose. But I would say with the COVID, take into consideration the exposure, known exposure, so the risk factors, symptoms usually will progress, right? So it's something, if this is really like a serious or more serious infection, you will see additional symptoms. So you could have diarrhea, you could have, coughing, you will have, problems with sense of smell and taste, which, probably is not going to be reported by younger kids. So you'd be looking, is there a progression? Is there any fever? It's so uncommon for our patient population to develop fever with allergic symptoms. So if you usually, like, if there's fever, it means that there's infection, right? So that's sort of like no-brainer. So fever, exposure, like if they're known exposure, so for instance, somebody else is sick, somebody in the family, and then, progression of symptoms. Usually, allergic symptoms don't start abruptly. They're sort of like, they just take several days and you start slow and then they sort of accelerate over time, but it's still just, sneezing and runny nose, and, you don't get fever. So absolutely, it is important, but that's again, more reason to emphasize that if you suspect allergies, get your child tested, because it's better to know, and it will also, inform your decisions when your child goes back to school.
Yeah, we've had a lot of patients come in with children with chronic runny noses, and their parents, they want them allergy tested because they don't want confusion when they go back to school. They don't want their kids to have to quarantine for 2 weeks because they have a runny nose. They want to be able to say, no, this is actually allergies, and I know that. They've been tested, they've been seen by the allergist. These are the medications that they're on.
So that may answer my question. I was just going to say, if someone has a history of seasonal allergies, like what should they do to avoid, being sent home from school or daycare for these symptoms?
Well, I think if they're sent home, kind of suddenly by the nurse's office, you'll probably have to go to the doctor and get COVID tested. There's almost like no go around in that situation. But if you know that your child has a particular season that they tend to flare or worsen with their allergy symptoms, it's best to come in, like Dr. Novak said, early, like January, February, but now we're in April. So come in April and then get them tested to identify what they're allergic to.
But I think it's very important to talk about like proper use of medications. I mean, a lot of the time, right? Like you had those patients with hives, right? Right now, there's something going on with the hives in the community, but and people will use like medication, when they see the hives, right? So when the symptoms appear, so as needed, we call it PRN. But really, those are chronic conditions. The medications work best if they're used consistently. So your best bet to prevent your kid being sent home from school is to give the medication, in the morning before school or at night, as prescribed. Use your eye drops, tell your kid to wash their hands and face when they come, if they go play outside and then come back to the classroom. So be proactive about it. Don't wait for the symptoms to really get out of hand, because then, it becomes very confusing. But prevent.
So we had a question from a viewer. They said, my nephew is fidgety and has difficulty concentrating. Could behavior issues like this arise from discomfort of seasonal allergies?
Yeah. Go ahead.
Yeah, we could definitely see fidgety behaviors, especially, if they're feeling tired, and sometimes kids, they act what we call paradoxically. So if they're tired, they get cranky and more irritable, more hyperactive. You can certainly see that, but, they should have other symptoms to suggest allergies. It may not always be itchy eyes, runny nose, sneezing. Sometimes it could just be chronic nasal congestion, where you really need someone to look in their nose and identify that they're swelling. Or sometimes we can see subtle signs. We call them allergic shiners, where kids get dark circles under their eyes. I have a friend, she's in sleep medicine. For snoring, they send a lot of their patients for allergy testing. So if someone has snoring, poor sleep, and that's causing fidgeting during the day, that also could be a sign of allergies.
Yeah, absolutely. The poor quality of sleep is so, pervasive in our patients, with the uncontrolled symptoms, and it really makes them miserable. They cannot pay attention. And, there's a concern sometimes, some of the medications, right, have the side effect of making kids a little drowsy, but the condition itself, allergic inflammation, all of the, manifestations are actually causing the, discomfort and lower attention span. And kids, it's known they have problems, concentrating in school and paying attention and sitting still. So they can get quite miserable.
So we're about to wrap up. My last question is just any final thoughts or message for parents that you may, want to add to our conversation?
Well, I think that I'm glad we're talking about about this issue. It's really affecting a lot of kids. I mean, depending on a study, between 15 to 40% of children, teenagers have allergic rhinitis. So that's a very common issue. And having a correct diagnosis and then managing it proactively to control the symptoms and prevent symptoms getting out of hand is very important, and beneficial to the patients. And coming for evaluation is also part of that, proactive approach. So that's important.
Yeah, I would add that, though many of the medications are available over the counter, many of our patients are not using them correctly. And so,
Yeah.
if your symptoms are, increasing and your children, you feel like they're suffering with their allergies, don't just feel like switching around medicines and trying different drugstores. Whatever the pharmacist recommends is going to work. Sometimes you do need to see, the allergist to identify what people are allergic to. Often people come in, they think they have one thing and they end up being allergic to something very different on testing. And that happens to me multiple times a day. So I think, it's important to get plugged in with the right specialist.
Great. Well, thank you everyone for joining, and thanks to our experts, Dr. Novak and Dr. Brar. So for more information, you can go to nyulingo.org, and we'll also add a direct link to Hassenfeld Children's Hospital in the comments below.
Thank you, Katie.
Yeah.
Thank you, Rupam.
Thanks,
Thank
Katie.
you.
Thanks, Dr. Novak.